Take me out.
Hi everyone, I'm Daniel.
And I'm Emily, and today we're talking about the National Patient Safety Goal .06.01.01, using alarms safely.
This goal includes making improvements to ensure alarms on medical equipment are heard and responded to on time.
Did you know that a nurse typically has to respond to 150 to 400 alarms per shift?
And did you know that reacting to and responding to alarms can make up 35% of a nurse's shift in the ICU?
Did you know that 85 to 90% of these alarms are false or don't require medical intervention? A study done by the International Journal of Environmental Research and Public Health found that 98% of nurses believe that these nuisance alarms disrupt patient care and reduce confidence in alarm systems. They also found that 81% of nurses believe that an excess of nuisance alarms is a main cause of alarm fatigue.
Also, did you know that in just 3 years, the Joint Commission's Centennial Event Database recorded 98 adverse events in the U.S. that were due to incorrect or delayed response to an alarm? 80 of these resulted in the death of the patient. In many of these cases, the death or injury was caused by medical personnel ignoring or not noticing an alarm, rather than an alarm just not working.
This database also found that multiple contributing factors can lead to these adverse events. These include alarm fatigue, alarm settings that aren't customized to the individual patient, inadequate staff training on proper use of equipment and interpretation of alarm signals, inadequate staffing to support or respond to alarm signals, and lastly, equipment malfunctions or failures.
So what is alarm fatigue? It is a sensory overload that results from an exposure to an excessive amount of alarms, and it is a serious obstacle when pursuing alarm safety. The constant stimulation of alarms can cause delayed reaction times, alarm desensitization, sensory overload, and ignoring or turning down alarms. Being in a constantly loud environment can also discourage communication and collaboration, intensify aggression and irritation, and contribute to acute and chronic stress. It can also hinder the ability to process social signals.
Here's a diagram that helps show some of the more in-depth causes of alarm fatigue. These include equipment programming errors, excessive workload and staffing issues, desensitization to alarms, inefficient and poor alarm design, having no contingency or escalation plan, competing priorities, and unclear delineation of responsibility.
Now we can take a deeper look on how these factors are contributing to alarm fatigue. So for equipment programming errors, there are many different types of medical devices and equipment that nurses and other healthcare personnel use. This personnel must be educated on how to properly set up and maintain this equipment. When equipment is programmed incorrectly, there can be an increase in nuisance alarms and in alarms in general. This can lead to an increase in alarm fatigue and decrease alarm safety.
Now we'll talk about excessive workload and staffing issues. As we know, staffing is an issue in healthcare facilities all around the country. Especially with COVID, the nursing shortage continues to be a huge problem. An article from the National Council of State Boards of Nursing reported that from 2021 to 2023, around 100,000 registered nurses left the workforce, and another 610,000 registered nurses reported an intent to leave by 2027. Some of the reasons for this included an increase in workload, feeling fatigued, feeling emotionally drained and used up, burned out, and at the end of their rope. With the decrease in the number of nurses and the available nurses feeling very overwhelmed and being overworked, it makes sense that alarm safety is going to suffer. These nurses are more likely to take longer to respond to alarms, make mistakes when setting up alarms, reducing alarm volume, or ignoring the alarm altogether.
As we've learned, nurses and healthcare personnel have to listen to hundreds of alarms all day, every day. We've also learned that a high number of these alarms are clinically insignificant. 85 to 90% of these alarms that go off don't actually require medical intervention and can disrupt staff and patients. Being exposed to this quantity of alarms can cause healthcare staff to become desensitized, and as we've learned, this can lead to many other problems, including alarm fatigue and adverse events. As we can see, this nurse looks very fatigued.
When alarms are not designed or implemented optimally, patient harm, staff burden, and frustration can occur. Some studies suggest unstandardized alarm sounds and inappropriate alarm settings can lead to nuisance alarms and alarm fatigue. Alarms should be detectable, discriminable, and identifiable. When they are not, they can just become background noise that overwhelms staff.
If there is no plan in prioritizing certain alarms, there is a higher risk of alarm fatigue, as alarms will sound for longer than they need to.
Many healthcare facilities face budget, time, and resource constraints, which can lead to an inability to properly prioritize alarms and their safety. It may be difficult to know which alarms to prioritize if there are many going off at the same time, especially when many sound similar and when there are nuisance alarms going off. This can lead to alarms not being answered as quickly as needed and an excess of alarms.
When communication is poor, staff can be unaware of whose responsibility it is to answer alarms. This can add to alarm fatigue as alarms will continue to sound without being answered because the task was never properly delegated. As we all know, there are a lot of different types of alarms in healthcare settings. These include bedside physiologic monitors like pulse ox alarms, bedside telemetry, blood pressure monitors, central station monitors, infusion pumps, ventilators, and bed alarms. And I'm sure we've all experienced the overstimulation of these alarms at our clinicals, and that's just at 8 hours. If you don't, here's a little taste of what alarm excess can sound like.
Wow, that's annoying. Imagine having to listen to that for hours on end and multiple days a week. I'd probably develop alarm fatigue too. So, how can we help prevent alarm fatigue and improve alarm safety?
One way we believe alarm safety can be improved is by adjusting parameters on certain alarms. For instance, bedside telemetry devices have options that can be adjusted to determine when it will trigger an alarm. If a patient's baseline heart rate is in the 50s, then the parameters can be set to not trigger an alarm until their heart rate drops below 50, and this can be applied to other vitals as well, such as blood pressure. By doing this, it can reduce the number of times a nurse has to respond to a false alarm. Bed alarms are another example of an alarm that can be adjusted to fit an individual patient's needs. Many bed alarms that are built into beds come with different areas of sensitivity that can be adjusted depending on what the client's fall risk is. So let's say a patient who has a very high fall risk can be set to the most sensitive parameter, which notifies staff of movement, even if it's very minimal, that indicates that the patient is attempting to move on their own.
Patients should be taught about the need for alarms as well as the actions that should occur when an alarm goes off. This helps set expectations and allows patients to participate in their care. On rounds, it's a good practice to discuss how alarms should be used and to inquire about the patient's experience with alarms, including how they may be interfering with sleep or rest. Discussion of alarm settings and changes to those settings should allow for patient feedback and include education for patients so that they understand the rationale for the adjustments and what is likely to happen. Such education will decrease the chances that patients will feel the need to change or disable alarms themselves.
Nurses can also take on the role of teacher by teaching personnel that might not be comfortable or familiar with different types of alarms. As long as it's in their scope of practice, we can help assistive personnel learn how to silence different types of alarms.
Some hospitals have implemented the use of specialized teams that monitor how well alarms are being used. While most interventions to date have focused on nurses, one hospital found that a team-based approach, combined with a formal alarm management committee structure and broad-based education, led to a 43% reduction in critical alarms.
Nurses can also improve alarm safety by answering alarms on their own. It can be easy to let a call light keep ringing until the assistive personnel can get to it, but by responding to alarms ourselves, we can reduce the amount of alarms going off at any given point. At
Powell Valley Healthcare, the Quality Improvement and Risk Management Services Director and Inpatient Services Director are working towards implementing and improving the safety goal of alarm safety in their healthcare facility.
Although there are no specific alarm management policies or procedures in place at PVHC, they do have a practice that all their employees are trained on. Sarah Welling, the Quality Improvement and Risk Management Services Director, told us about their practice of a no-pass zone. This is specific for call lights in both the long-term care center and the hospital. If any staff member, regardless of where they are working, walks by a patient or resident's room and their call light is on, they are to answer that call light.
There's also not currently a specific question about call light response time or satisfaction on PVHC's patient satisfaction surveys, but Sarah Welling said this is something they would be willing to look into in order to help assure goal achievement.
As we've learned, there is so much that goes into ensuring alarm safety. All healthcare facilities should be striving to make improvements to ensure that alarms on medical equipment are heard and responded to in a timely manner.
In doing this, we can help reduce adverse events and keep our patients safe.
Thank you.